Normally, at rest or with minimal activity, the heart beats regularly at a rate of about 60 to 100 times per minute, triggered by its own electrical conduction system. When the conduction system is working properly, the sinoatrial, or SA node, acts as the heart's natural pacemaker. The SA node generates an electrical impulse that travels to the atrioventricular, or AV node, bundle of His, right and left bundle branches, and Purkinje fibers. Collectively, the AV node and His bundle are often called the AV junction. Each time the cardiac electrical signals reach the Purkinje fibers, they cause the ventricles to contract, which creates a heartbeat. An electrocardiogram, also known as an ECG or EKG, is the graphical recording of the heart's electrical activity. The ECG records two physiological events: depolarization, or the spread of a stimulus through the heart muscle, and repolarization, or the return of the stimulated heart muscle to a resting state. Specifically, each ECG waveform, interval, and segment reflect a specific aspect of the heart's electrical conduction activity. The SA node sends electrical impulses throughout the blood-filled atria, causing them to depolarize. This produces the P wave on the ECG. Atrial depolarization triggers atrial contraction. The impulse then travels to the AV node, where there is a slight pause between the onset of atrial activation and of ventricular activation. This short delay corresponds to the PR interval. The AV node then conveys the impulse to the ventricular muscle cells via the His-Purkinje network, producing ventricular depolarization. Electrical activation of the ventricles is represented by the QRS complex on the ECG. Finally, the ventricles repolarize, reflected on the ECG as a ST segment and T wave, sometimes followed by a small deflection called the U wave. Before the next P wave, the ECG tracing returns to its baseline. With every heartbeat, the entire P, QRS, ST, T cycle repeats, creating the physiological signature of sinus rhythm on the ECG tracing.